Hi, my name is Marcy with brainandspinalcord.org. Today I'll be bringing you some information on necessary steps that should be taken following an injury. Be sure to check the website for all relevant links and recap of this article. Brain and spinal cord injuries are not only physical and emotionally difficult, but life following the injury can be extremely difficult to navigate. The patient, as well as his or her friends and family, are likely to be overwhelmed as they try to make sense of what has happened. They don't know what to expect, they don't know how to move forward, and they're not sure what's coming next. It's certainly a confusing time, but whether you're a survivor or a loved one of a survivor, there are 3 basic steps that will ensure you deal with the situation as effectively as possible. The first step is to educate yourself. At this point, the survivor and his or her loved one will want to learn as much as possible about the particular injury, as well as potential treatment options and possible long-term outcomes. While there are a variety of resources and support groups designed to give you the answers you need, a medical team that specializes in brain or spinal cord injuries can also serve as a knowledgeable and trustworthy source. A list of questions you may want to ask will be posted on our website at brainandspinalcord.org. The second step is to deal with the present. Focus on the recovery by doing all that you can to ensure the healing process moves forward. The initial time following a brain or spinal cord injury can be frustrating, filled with moments that take you 2 steps forward and 1 step back. Both the survivor and his or her loved one should remember that recovery will evolve at its own pace. Effort is important, but so is patience. Support is extremely important at this stage, and the medical team can introduce you to support groups and organizations that will help you navigate life after injury. Because the survivor may not always know what is best for him or her, being surrounded by supportive, knowledgeable people is necessary to effective recovery. The survivor should attempt as much independence as possible, but should ask for help when needed. Family and loved ones should allow the survivor to do as much as possible, but should give him help when asked. Someone close to the survivor, a family member or friend, should also take on the duty of keeping others updated on the survivor's condition. Keeping a blog and circulating the URL to friends and family is a wonderful way to keep everyone posted. The third step that should be taken following a brain or spinal cord injury is to prepare for the future. Life will be different for both the survivor and his or her loved ones, and preparation is the key to meeting goals and needs head on. Experiencing a brain or spinal cord injury need not be the end of the world, and focusing on the future and what it holds can offer hope to survivors and their loved ones. Looking forward to the future should include setting goals, determining long-term care needs, researching clinical trials and other treatment, determining assistive equipment needs, and finding support groups and relevant organizations. A 3-pronged approach comprising education, dealing with the present, and dealing with the future will allow both the survivor and his or her loved ones to effectively navigate the time following a brain or spinal cord injury. Effective coping skills are critical to recovery. This concludes our segment on 3 steps that should be taken after a brain or spinal cord injury. Remember to check our website for the most up-to-date information, including resources and tips regarding brain and spinal cord injuries. Thanks for watching.